I think you've just gotten an overview of what the next 2 days is going to be like, really trying to drill down. One of the things that I think is really important to recall is the evidence base that Andy presented, especially around work in cities, is actually quite new as academia goes. It's maybe 20 years or so people have really been focusing sort of deeply on the broader determinants of health aside from healthcare. So while the dominant conversation in the health sector is still biomedical research and personal health care technology and others, our understanding of the impact on health of these other sectors has dramatically increased. I hope you got the sense of that. It's a very important observation from his presentation. And then also to say that all the sectors, and especially business sector, what happens in cities affects business, but also the role that multiple sectors can play and must play really to achieve overall global health. So we're now delighted to have two scholars who've been deeply involved in urban work for many, many years, ahead of their group perhaps. Dr. David Lahoff, who is currently the Associate Dean for Research and Professor at the Yale School of Nursing and Professor of Epidemiology at the Yale School of Public Health, and he was director of the Center for Urban Epidemiologic Studies at New York Academy of Medicine, which really launched our International Society for Urban Health, and has edited 4 books on urban health, the most recent with Sandro Galea, Dean of the School of Public Health at Boston University, and came out really in the last couple of months. And he will be presenting on sort of the conceptual framework to look at issues in cities, determinants of health, with an example of housing. And he'll be followed by Dr. Ana Diaz-Rue, and maybe I could invite, since we're not getting in the way of slides here, to join us at the podium. Anna is the Dean of the Dornsife School of Public Health and directs the Urban Health Collaborative at Drexel University. She is internationally known really for her research for many years in social determinants of health and a special focus on health inequities, and is the director of the Wellcome-funded Sal Orbal, which is one of the 5 Wellcome-funded research networks in urban health around the world. So we'll each of them to speak in sequence, and then we'll open it up for questions and answers with the panel. David? They can come here or sit there, however you prefer.